Welcome to our exploration of the role of nuclear medicine in diagnosing and treating gastrointestinal disorders. In this video, we'll delve into how nuclear medicine techniques are essential in digestive healthcare. Gastrointestinal disorders, including inflammatory bowel disease, IBD, gastrointestinal bleeding, and motility disorders, can significantly affect a person's quality of life. Early and accurate diagnosis is crucial for effective treatment and management. Nuclear medicine provides powerful tools to assess and diagnose various gastrointestinal conditions. These techniques offer non-invasive methods to visualize and measure the function of digestive tract. One of key procedures is gastric emptying study. This test evaluates how quickly food leaves the stomach, essential for diagnosing motility disorders such as gastroparesis, functional dyspepsia, and other disorders that cause delayed gastric emptying. During a gastric emptying study, the patient consumes a meal that contains a small amount of radioactive material, usually technetium-99m, which allows for imaging. A gamma camera takes images at specific intervals to track the passage of the radioactive meal through the stomach. The study typically lasts 4 hours, with images taken at intervals. The images produced help determine the rate of gastric emptying, providing critical information for diagnosing and managing conditions that affect stomach motility. The HIDA, hepatobiliary iminodeacetic acid. Scan evaluates the function of the gallbladder and bile ducts, crucial for diagnosing biliary tract disorders. It involves injecting a radioactive tracer into a vein and using a gamma camera to track the tracer's journey through the liver, gallbladder, bile ducts, and small intestine. This scan assesses bile production, storage, and release, aiding in the diagnosis of conditions like gallstones and bile duct obstructions, gallbladder inflammation, cholecystitis, bile leaks. For patients with unexplained gastrointestinal bleeding, a GI bleeding scan is vital for identifying the source of bleeding. A small sample of the patient's blood is drawn. The red blood cells from the sample are tagged with a radioactive tracer, usually technetium-99m, and are re-injected into the patient's bloodstream. This nuclear medicine procedure uses a gamma camera to track tagged red blood cells, helping to pinpoint the exact location of bleeding and guide targeted treatment. Nuclear medicine also plays a role in diagnosing inflammatory bowel disease through white blood cell scans. These scans detect inflammation and infection in the intestines, providing detailed information about the location and extent of inflammation, aiding in the diagnosis and management of conditions like Crohn's disease and ulcerative colitis. The GER, gastroesophageal reflux. Scan, also known as a gastroesophageal reflux scintigraphy or nuclear medicine reflux scan, is a diagnostic imaging test used to evaluate the presence and severity of gastroesophageal reflux. The scan uses a small amount of radioactive material to visualize the movement of stomach contents into the esophagus. It helps healthcare providers diagnose GERD, assess its severity, and evaluate the effectiveness of treatment strategies. The integration of nuclear medicine with other diagnostic and therapeutic modalities allows for a comprehensive approach to gastrointestinal healthcare, ensuring that patients receive the most accurate diagnoses and effective treatments. Follow-up imaging with nuclear medicine techniques is essential for monitoring the effectiveness of treatments and managing chronic gastrointestinal conditions. These scans help to track disease progression and adjust treatment plans as needed. Advancements in molecular imaging are enhancing our understanding of gastrointestinal diseases at the molecular and cellular levels. This allows for early detection of conditions like colorectal cancer and liver diseases, enabling preventive measures and early interventions. From early diagnosis to advanced treatment, ongoing research, and future innovations, nuclear medicine is transforming digestive healthcare, offering hope and improved outcomes for patients worldwide. Thanks for watching. Please like, share, and subscribe